Hey folks, it's Spitz with Pixels and Pills at the EDTC Revolutions Conference in Washington, D.C. 2012. It's my pleasure to have Wendy Blackburn with us this afternoon, Executive VP, blogger, influencer. There's not a Twitter chat or a Twitter stream without Wendy hanging out and providing her insights and input. It's always a pleasure monitoring your stuff and interacting with you online.
Thanks
as well
for all the
retweets. Absolutely. That's my job. I'm a Wendy retweeter. And we're here at EDTC Revolutions. And what's fascinating to me is it's about the patient and the patient's behaviors within the healthcare space, but also how they're interacting with the digital channel. And as the different channels have changed and evolved and the different milestones have been crossed, everything from conventional websites to more interactive dynamic experiences to the revolution that was social media only a few years ago, and now the explosion that's mobile. There's this weird synergy between patients and their expectations and their behaviors and then the platforms that they're using. So I know that's kind of a loopy open-ended question, but being the digital health expert that you are, how do you kind of bring all this together, and how does that ultimately translate into recommendations that you make for your clients?
Sure. You know, when I started in pharma marketing 15 years ago, we spent a lot of time looking at trying to understand the patient mindset and their attitudes and their thought process. That's still obviously really, really important. But today there is this whole extra layer of how do they behave online? What are their digital behaviors? At what point are they looking for what information, in which channel, on which site, etc. So we have all these tools as digital marketers, but it's really important to understand how to use those and how to reach the patient and be where they are when they're looking. So that's something we're always, for every client, really trying to understand and look at really closely. We also talk about that we have to understand the consumer's mindset, the patient's mindset, and their expectations from our industry. From any company or product that they might interact with, there's a certain level of expectation today of being mobile savvy, of being social friendly, and I think, as we all know, pharma is a little behind the curve there.
Absolutely.
So we're always trying to help our clients, again, understand it from the patient perspective, that even though it's hard to do social and hard to do mobile, and there's a lot of new technologies and platforms available to us, we really have to remember the expectations of the patient and serve up what they're looking for and what their needs are.
Great. One thing that's impressed me the most about InTouch is really your sensitivity to both the patient and their needs and how they ultimately engage with the evolving technologies. And you've been kind of on the pulse of both, kind of like you mentioned, insights about patient behaviors, but also being ahead of the curve really with mobile within the healthcare space and even social going a few years back. How do you ascribe that kind of forward thinking? What quality in your organization engenders that ability to take those risks and really kind of hit it out of the park a little bit earlier than most?
Yeah, thanks, and thanks for the kudos. I can't take credit for them. First of all, I think it goes back to one that we've always done pharma marketing. We've always been involved in pharma from the very early days of digital, so we really understand the industry. So that helps.
Right.
So when we see a problem or a challenge of pharma, for example, being able to engage in the social space, we look for solutions because we believe that there's an opportunity there. So we have a great history of doing that, I think. And I also have to give credit to our CEO, Farouk Capon, who founded our company, who still leads us today. And he is the one that's always really pushing us. What's new? What's next? What are some new ways to reach patients and physicians? And what are some creative ways that we can leverage all of these platforms for our clients to help them do their job? So he really pushes the culture for that.
Yeah, that's great. And one theme that's been resonating throughout the conference, too, is the evolution not only of the patients and the technology, but the supporting structures that surround them. So from an agency point of view, there's the digital focus and then the branching out of digital into a broader full channel approach. How do you see the evolution of the agency model working well with pharma and medical device in general, and where do you see InTouch going in a few years?
Sure. It's something we talk about a lot, and I know Ad Age just had an article of someone mentioned Pharmageddon. Coming from the digital side of things, I think eventually we'll all meet in the middle with our own specialties. So the traditional agencies have added on digital capabilities. We have been asked by many clients to say, you know what, 80% of our budget is digital.
Right.
Our patients are online. Can you just
Right.
do the in-office brochure and the direct mail pieces that I need to do and do that all? And we certainly can and will do that too. So we're doing more of that. We had an AOR pitch this week to be the sole agency involved, and by the same token, traditional agencies are doing a lot more digital too. So again, I think we'll all just meet in the middle at some point and have our own heritage and our own specialties.
Yeah, and it sounds to me that by what you're saying, collaboration really is the key. You can't have a single entity that's able to support all these needs at one point. So maybe the evolution moving forward is reflective of the technology itself, which is just segmenting and creating targeted solutions with specialties that are able to present those core competencies in a way that work best working together.
Exactly.
Sounds great. It's Wendy Blackburn, Executive VP of InTouch Solutions. I'm Spitz with Pixels and Pills, and we're at the EDTC Revolutions Conference in Washington, D.C., 2012. Signing off.